Question 1. A patient with schizophrenia is pacing, muttering, and clenching fists. What is the nurse's priority action? A. Ask if they are hearing voices. B. Guide the patient to a quiet room. C. Administer PRN antipsychotic. D. Maintain distance and assess for escalation. Answer: D. Maintain distance and assess for escalation. Rationale: the patient is exhibiting signs of potential aggression. The nurse must first ensure safety through situational awareness before attempting verbal engagement. Options A, C are appropriate later, but not as an immediate safety measure. Question 2. During discharge planning, a patient with schizophrenia says, "I don't need my meds anymore." Which response by the nurse demonstrates effective motivational interviewing? A. You must take them or you'll relapse. B. Let's discuss your experience with the meds so far. C. Skipping meds is dangerous. The doctor won't approve. D. That's not an option right now. Answer: B. Let's discuss your experience with the meds so far. Rationale: this response invites collaboration and insight without judgment, aligning with motivational interviewing. A, C, and D are directive and may cause defensiveness. Question 3. A patient with schizophrenia becomes increasingly paranoid, stating, "You're poisoning my food." What is the most therapeutic response? A. That's not true, you're imagining things. B. I assure you the food is safe. C. You seem frightened. Can we talk about that? D. Would you like to eat something else? Answer C. You seem frightened. Can we talk about that? Rationale: this validates feelings without reinforcing the delusion and promotes trust. A invalidates, B is confrontational, D avoids therapeutic processing. Question 4. A newly admitted patient with schizophrenia refuses to bathe and change clothes. What should the nurse do first? A. Call psychiatry to assess insight. B. Educate the patient on hygiene importance. C. Assess for cognitive or perceptual disturbances. D. Document non-compliance and continue care. Answer: C. Assess for cognitive or perceptual disturbances. Rationale: poor hygiene may be due to hallucinations, delusions, or avolition. Assessment guides the care plan. Other choices bypass root causes. Question 5. A nurse hears a staff member say they're schizophrenic. What do you expect? What is the best professional response? A. We all feel frustrated sometimes. B. Please avoid labeling language. C. You should report that comment. D. I agree. It's difficult to manage them. Answer: B. Please avoid labeling language. Rationale: using person-first language, e.g., person with schizophrenia, is essential. This option corrects the stigma respectfully. A and D enable bias. C is avoidance. Question 6. A nurse caring for a patient with paranoid schizophrenia notices the patient avoids eye contact and appears withdrawn. What is the most therapeutic approach? A. Sit quietly near the patient without forcing interaction. B. Encourage group therapy for socialization. C. Ask the patient to make eye contact while speaking. D. Reassure the patient that no one will harm them. Answer: A. Sit quietly near the patient without forcing interaction. Rationale: presence without pressure promotes safety and trust. B may overwhelm. C is confrontational. D addresses paranoia prematurely. Question 7. Which documentation is most appropriate for a patient with disorganized speech due to schizophrenia? A. Speech is nonsense. B. Speech is fragmented, loosely associated. C. Patient not making sense today. D. Conversation was bizarre and pointless. Answer B. Speech is fragmented, loosely associated. Rationale: this is objective, clinical, and descriptive without judgment. The others use vague or stigmatizing language. Question 8. A nurse is preparing to educate a patient with schizophrenia about medications. What is the first priority? A. Provide a detailed pharmacologic explanation. B. Evaluate the patient's current level of understanding. C. Emphasize medication adherence. D. Assess the patient's willingness to take meds. Answer: B. Evaluate the patient's current level of understanding. Rationale: assessment comes first in the nursing process. C and D follow after understanding is established. A may overwhelm the patient. Question 9. A patient on clozapine reports sore throat and fatigue. What is the priority action? A. Educate on common side effects. B. Reassure that this is normal. C. Notify the provider and check white blood count. D. Encourage hydration and rest. Answer: C. Notify the provider and check white blood count. Rationale: these symptoms may indicate agranulocytosis, a serious adverse effect of clozapine. Immediate labs are needed. Question 10. A nurse is reviewing lab results for a patient on risperidone. Which finding requires immediate attention? A. Mild sedation. B. Fasting blood sugar of 170 mg per deciliter. C. Mild tremor. D. Mild weight gain. Answer: B. Fasting blood sugar of 170 mg per deciliter. Rationale: atypical antipsychotics can cause metabolic syndrome. Elevated glucose may signal new-onset diabetes. Question 11. A client with schizophrenia insists the staff is recording their thoughts. What is the nurse's best response? A. That's not true. B. You're imagining it. C. That must be frightening. I don't hear any recordings. D. You know that's not happening, right? Answer: C. That must be frightening. I don't hear any recordings. Rationale: this response validates the emotion, but does not confirm the delusion. It is supportive and grounded in reality. Question 12. A nurse working in a psych unit feels overwhelmed by repeated aggressive episodes from a patient with schizophrenia. What is the most ethical response? A. Request reassignment away from this patient. B. Reflect on personal feelings and seek supervision. C. Avoid the patient and minimize interaction. D. Tell the patient their behavior is frustrating. Answer: B. Reflect on personal feelings and seek supervision. Rationale: professional self-awareness and support protect therapeutic boundaries. A and C reduce care quality. D is unprofessional. Question 13. Which patient behavior suggests effective management of schizophrenia? A. Refusing all medications. B. Isolated and withdrawn most days. C. Attending therapy and participating in care planning. D. Expressing constant fear of harm. Answer: C. Attending therapy and participating in care planning. Rationale: engagement in treatment and self-management indicate stability and insight. The other options suggest symptom exacerbation. Question 14. A newly diagnosed patient with schizophrenia asks, "Will I ever be normal again?" What is the nurse's best response? A. You have a serious condition that needs lifelong care. B. Many people live full lives with support and treatment. C. It's too early to say. D. This disorder makes life very difficult. Answer: B. Many people live full lives with support and treatment. Rationale: this response offers hope grounded in reality. A and D are discouraging. C lacks empathy and reassurance. Question 15. Which nursing intervention best supports reality orientation in a disorganized patient with schizophrenia? A. Engage in logical arguments to correct delusions. B. Repeat factual information calmly and consistently. C. Distract the patient with unrelated topics. D. Provide visual stimulation and loud background noise. Answer: B. Repeat factual information calmly and consistently. Rationale: calm, factual repetition grounds the patient. A worsens agitation. C avoids orientation. D increases sensory overload. Question 16. A patient with schizophrenia is seen staring blankly for long periods and does not respond to stimuli. What condition should the nurse assess for? A. Paranoid delusions. B. Catatonia. C. Disorganized speech. D. Akathisia. Answer: B. Catatonia. Rationale: mutism, posturing, and unresponsiveness are classic signs of catatonia, a medical emergency requiring prompt evaluation. Question 17. A patient reports hearing a voice saying, "You are worthless." What is the priority nursing action? A. Ask what the voice is telling them. B. Reassure that they are safe. C. Encourage distraction techniques. D. Assess for suicidal ideation. Answer: D. Assess for suicidal ideation. Rationale: command hallucinations may direct harmful behaviors. Safety is the priority. Other options follow after suicide risk is ruled out. Question 18. A nurse delegates a task to an aide for a patient with schizophrenia. Which task is inappropriate to delegate? A. Assist with hygiene. B. Monitor for hallucinations. C. Provide snacks and fluids. D. Escort to group therapy. Answer: B. Monitor for hallucinations. Rationale: only licensed personnel should assess or monitor mental status changes. The other tasks fall within a CNA scope. Question 19. Which finding in a patient on haloperidol requires immediate intervention? A. Sedation and dry mouth. B. Lip smacking and facial twitching. C. Constipation. D. Insomnia. Answer: B. Lip smacking and facial twitching. Rationale: these are signs of tardive dyskinesia, a potentially irreversible side effect. Early identification is critical. Question 20. A patient stabilized on medication for schizophrenia states, "I feel fine now and don't think I need this anymore." What is the nurse's best response? A. You need to keep taking it no matter what. B. Let's talk about how the medication helps you stay well. C. If you feel fine, we can try stopping it. D. That decision is up to the doctor, not you. Answer: B. Let's talk about how the medication helps you stay well. Rationale: this response encourages insight while promoting adherence through collaboration and education. The others are either dismissive or authoritarian. Question 21. A patient with schizophrenia states, "I hear voices telling me I'm worthless." Which is the most appropriate initial nursing response? A. You're not worthless, don't think like that. B. What are the voices telling you to do? C. Ignore those voices, they aren't real. D. Have you taken your medication today? Answer: B. What are the voices telling you to do? Rationale: assessing for command hallucinations is a priority, as they may pose safety risks. Option B allows the nurse to assess risk for harm. The others either invalidate the experience or skip critical assessment. Question 22. A patient with schizophrenia has stopped eating and whispers, "The food is poisoned." What should the nurse do first? A. Educate about food safety. B. Offer sealed, packaged food options. C. Notify the dietitian for alternative options. D. Encourage the patient to eat while supervised. Answer: B. Offer sealed, packaged food options. Rationale: this addresses the delusion without confrontation, promoting trust and nutrition. The other options are less effective initially. Question 23. A nurse is reviewing discharge plans with a patient stabilized on antipsychotic therapy. Which statement requires follow-up? A. I'll take my medications as prescribed. B. I plan to stop meds when I feel better. C. I'll attend outpatient therapy weekly. D. I'm moving in with a supportive sibling. Answer: B. I plan to stop meds when I feel better. Rationale: this shows a lack of understanding of the chronic nature of schizophrenia, which requires long-term adherence to treatment. Question 24. A patient with schizophrenia is pacing, agitated, and muttering to themselves. What is the nurse's priority action? A. Ask the patient what is bothering them. B. Notify the provider immediately. C. Encourage the patient to rest quietly. D. Remove other patients from the area. Answer: D. Remove other patients from the area. Rationale: the behavior signals potential escalation. Safety of others must be ensured before further intervention. Question 25. A nurse notices a patient with schizophrenia is refusing medication and says, "You're all trying to control my mind." What is the most therapeutic response? A. That's not true. You need your meds. B. Can you explain why you feel that way? C. You know that's not real. D. If you don't take it, you'll get worse again. Answer: B. Can you explain why you feel that way? Rationale: this approach validates feelings without endorsing the delusion and promotes open dialogue. Question 26. A nurse overhears staff mocking a schizophrenic patient's delusion. What action demonstrates ethical nursing practice? A. Report the behavior to the charge nurse. B. Ignore it but document later. C. Tell the staff to be more discreet. D. Join in to maintain team rapport. Answer: A. Report the behavior to the charge nurse. Rationale: this is a violation of patient dignity and ethics. It must be addressed through appropriate channels. Question 27. A nurse is teaching a student about hallucinations. Which statement indicates a knowledge deficit? A. Hallucinations can be auditory, visual, or tactile. B. Voices telling the patient to harm themselves are not dangerous if ignored. C. Command hallucinations are especially concerning. D. Hallucinations can occur during severe stress or illness. Answer: B. Voices telling the patient to harm themselves are not dangerous if ignored. Rationale: command hallucinations are a high-priority safety risk and must always be assessed and not dismissed. Question 28. A patient with schizophrenia is disorganized and unable to follow multi-step directions. What is the best nursing strategy? A. Leave written instructions. B. Assign tasks with multiple parts to improve focus. C. Give one-step instructions calmly and clearly. D. Let the patient work independently to build confidence. Answer: C. Give one-step instructions calmly and clearly. Rationale: cognitive disorganization impairs processing. Simple and clear directions promote success and reduce frustration. Question 29. A nurse is preparing an education session for families of clients with schizophrenia. Which topic is most important to include? A. Healthy recipes to promote nutrition. B. Steps for organizing legal guardianship. C. Recognizing early signs of relapse. D. How to limit client independence at home. Answer: C. Recognizing early signs of relapse. Rationale: relapse prevention is essential in schizophrenia care. Early signs may include social withdrawal or sleep changes. Question 30. A patient newly prescribed risperidone begins to pace, has muscle rigidity, and a fever. What is the priority nursing action? A. Administer acetaminophen. B. Contact the provider immediately. C. Encourage rest and hydration. D. Document the findings and reassess in an hour. Answer: B. Contact the provider immediately. Rationale: this may indicate neuroleptic malignant syndrome and MS, a life-threatening reaction to antipsychotics requiring emergency intervention. Question 31. A patient with schizophrenia tells the nurse they implanted a chip in my brain. What is the nurse's most appropriate response? A. No one implanted a chip. That's not real. B. Tell me more about what you believe. C. You sound paranoid today. D. There's no scientific evidence to support that. Answer: B. Tell me more about what you believe. Rationale: this shows therapeutic communication, encourages trust, and helps assess the depth of delusion without confrontation. Question 32. During group therapy, a patient with schizophrenia becomes loud and accusatory. What is the nurse's immediate action? A. Redirect the group discussion. B. Confront the patient about their behavior. C. End the group session immediately. D. Escort the patient out to reduce stimulation. Answer: D. Escort the patient out to reduce stimulation. Rationale: de-escalation and reducing stimuli is key to calming the patient without shaming or escalating tension. Question 33. A nurse is monitoring a client on clozapine. Which finding is most concerning? A. White blood cell count of 2,900 per cubic millimeter. B. Increased appetite. C. Sedation after dosing. D. Weight gain of 2 pounds in a week. Answer: A. White blood cell count of 2,900 per cubic millimeter. Rationale: clozapine carries a high risk of agranulocytosis. A WBC below 3,000 per cubic millimeter requires immediate discontinuation and provider notification. Question 34. A client with schizophrenia believes the nurse is a spy. What is the most appropriate nursing approach? A. Attempt to convince the client otherwise. B. Avoid the client until their symptoms improve. C. Recognize the belief as a delusion and maintain safety. D. Challenge the belief to build reality orientation. Answer: C. Recognize the belief as a delusion and maintain safety. Rationale: confrontation worsens trust. Instead, acknowledge the experience and focus on supportive care and safety. Question 35. A nurse is caring for a patient with schizophrenia who isolates in their room, avoids eye contact, and responds slowly. What symptom is this most consistent with? A. Auditory hallucinations. B. Delusional thinking. C. Negative symptoms. D. Mania. Answer: C. Negative symptoms. Rationale: withdrawal, flat affect, and apathy are negative symptoms, which are often more disabling and less responsive to medication. Question 36. A patient with schizophrenia is about to be discharged. Which outcome indicates effective treatment? A. Patient continues expressing delusional ideas. B. Patient is withdrawn and minimally interactive. C. Patient engages in daily activities and communicates needs. D. Patient refuses all social interactions. Answer: C. Patient engages in daily activities and communicates needs. Rationale: functional improvements like social interaction and self-care show stabilization. Question 37. A nurse is evaluating a patient's understanding of antipsychotic therapy. Which statement is most concerning? A. I may feel sleepy at first. B. I'll stop the meds if I feel fine. C. I'll talk to my doctor about side effects. D. I'll avoid alcohol while taking this. Answer: B. I'll stop the meds if I feel fine. Rationale: stopping medication abruptly increases relapse risk. Patient education is critical. Question 38. A patient with schizophrenia develops tremors and muscle stiffness. What is the nurse's priority action? A. Administer PRN analgesics. B. Assess for extrapyramidal symptoms. C. Encourage hydration. D. Notify the psychiatrist after shift change. Answer: B. Assess for extrapyramidal symptoms. Rationale: these may be EPS due to antipsychotics, requiring medication adjustment or anticholinergic intervention. Question 39. Which nursing intervention is most effective in promoting medication adherence in a client with schizophrenia? A. Provide weekly pill boxes. B. Supervise medication administration in silence. C. Involve the client in treatment planning and choices. D. Emphasize consequences of non-adherence. Answer: C. Involve the client in treatment planning and choices. Rationale: shared decision-making increases autonomy, insight, and adherence. Question 40. A patient reports, "I stopped taking my meds because I felt controlled." What is the best response by the nurse? A. That's just your illness talking. B. Let's explore what made you feel that way. C. You know that's not true. D. You must follow doctor's orders. Answer. B. Let's explore what made you feel that way. Rationale. This promotes insight and trust, allowing the nurse to address underlying fears without confrontation. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.